Health of October 1st to order. The first item on business, under new business, is approval of the minutes of the September 3rd meeting. Do we have a motion to approve the minutes of the September 3rd meeting?
Motion to approve.
Second.
Thank you. The next item on the agenda is the Development Services Monthly Report submitted by Matthew Sheehan.
Good evening, everybody. As you can see, we had 2 new businesses open up in this reporting period. We had 2 businesses that failed. The Lowell Asian Bakery, I will note, closed on their own. The city did not shut them down, but they are back. They passed their re-inspection. As you can see, Sergeant Burgers was for equipment issues, but they have passed their re-inspection. Bring your attention over to the schools. All the schools are in a passed status, with the exception of the 2 food trucks.
Oh, why'd you say that? I was getting ready, let the moment linger for a
I
minute.
paused for a quick second.
What's happening with the food trucks?
So they had to put in, I guess, a PO to get the work done on the food trucks. So I'm waiting for that to be processed and the food trucks to be serviced, and I will get out there as fast as humanly possible to get those trucks into a passing status.
So they're not currently being used?
I can't comment on that, I'm not 100% sure. But when I did inspect them, they weren't cooking in them. I should stress
right,
that.
Right.
They're just transporting the food pretty much and serving the food out of warmers, out of the truck to
Right.
some of the schools that don't have, like, the full-fledged cafeterias in them.
Right, so where they're not cooking, the expired fire extinguisher is less of concern.
Less.
Correct.
Still
Unless
warmers.
the engine catches on fire, but that's
Yeah,
for something different.
yeah.
But like I said, all the schools are in compliance, so we will be going out probably in April, I think. I think that's what we did last year, so we'll go out again in April to do all the schools. It worked out good this year because I divided it between myself and 2 other team members. We hit everything in 2 days, so we're going to do the same thing again in April.
Do you give them a heads up? Give them a heads up. We'll be out there in 2 weeks, guys.
I try to do my best to dangle that carrot to say, hey, guess what?
I mean, we say it every October,
Right, right.
and
Yeah.
That's true, too. They already know, it's beginning of school year, they know, and it still doesn't
I
matter.
try to stress that as much as humanly possible, to give them the month that we're going to be there, in the hopes that everything is taken care of. Okay, before I get to the tattoo permitting process, just go over city ordinance enforcement. We went out to, during this reporting period, 5 other stores from the last reporting period. We found items in all of them. We did go back and re-inspect 446 Merrimack Street after the first inspection, which was on, it was 2 weeks ago. And they were found to have items, 106 total, so they were issued a fine for that.
it's a whopper.
Yes, 106 times 300. So they were issued a pretty hefty fine for having them on the property. I will say that I've been into several stores where word is out there. So, they say, nope, no pipes here, literally as soon as I walk in. So I don't know if they have a picture somewhere of me, but the word is out there, so it's working.
That's good.
So, to the temporary tattoo permit. I believe everybody has the draft copies in their packet.
So, for clarification, it's not a temporary tattoo permit, it's a temporary permit for tattooing.
Yes.
Right?
Yes.
So, I guess, well, just for clarification.
Yeah, no, I
You
can.
an English major?
Absolutely, I'll change the wording on the top of it, yes.
I think you should. I agree with her. You should. That temporary tattoo is something. It exists as an entity, so it's very confusing, right?
Yeah, we can change that.
So on the form, what is this piercing only? I don't know what the piercing on this.
So I've looked at the, they call them festivals, the events that happen in the state. So they allow piercers to come in and do piercings. So I put that down as an option, if we wanted to allow that during the festival. Because some tattoo shops are a mixed use, not in the city, but other tattoo shops in the state are a mixed use. They do tattooing and piercing on site. But again, to the preview of the board, you know, whatever you folks would like to do, I can absolutely remove that if you'd like, or we can leave it in. But that's what I've seen at different festivals in the state, so that's why I put it down there at the bottom.
But we don't have the same criteria for piercings that we do for tattoos.
We've stronger,
Yes, we do.
stronger.
When we
It's
do
the
out-
same,
when we
exact
go-
same?
When I go out to do the inspections, it's almost the same inspection.
Okay, all right.
For licensure, there's stronger. You need
But for
AAP,
licensure,
stuff like that.
yeah.
Right, that's so, right.
So, in,
Requirements for body piercing are different than tattooing.
So, I mean, we would hypothetically, it would,
But I guess these people coming from different states, right?
they do, but, so with that point, onto the second page, that everything that I am suggesting to you guys, is that everything be done with disposable, equipment. Because I don't want to entertain any idea of having to sanitize equipment on site, any kind of autoclave thing.
Yeah.
It has to be all disposable.
Right.
And again, this is just a draft document that I want to present to everybody. We can eliminate the piercing. I have no issue with that.
if
No,
we don't have mixed use in the city, then where would you find a piercing parlor?
So there is one gentleman on Central Street that does body piercing.
Okay.
And then all the other tattoo shops are specifically tattooing. That's it, that's all they do.
Right, so what is the specific difference between the two again?
There's different requirements for education. The big part is that they need A&P.
Can you use a mic?
Oh, sorry. Under the regs,
So they need
places
the
you
anatomy and
have A-
physiology for
A&P
piercings,
1
but
and
not
2.
tattoo.
And you don't need, we do a skin course for tattooing.
I guess my question would be, these people are all licensed to do piercings in other states. And the question is, do you think there's enough of a variation between states that we shouldn't just take them on their word that if they're licensed in another state, it's good enough for the sake of one day? I'm asking everybody. I personally, I have no problem with it if they're licensed in another state for the sake of one day. I think it's okay, but
So to that point, I would go up to the first requirement, that we would ask for their license, and how many, if they'd, and how long they have been doing it. And there's nothing to say that myself and my team, if we do this, myself and my team, we're gonna call, wherever they come from. I'm gonna call my counterpart in wherever it is, like whatever state they come from, to verify all the information that they give us.
right. Are there any states that don't require licensing for piercings?
Piercing?
Yes.
I'll get back to you on that. I'm not.
So that would be my concern, if that, Texas, they don't, I don't have to do any of that here in Texas. Just saying. They need to have a license to pierce from somewhere, right?
Absolutely.
So if their state doesn't require it and they don't have it, then the answer is like, sorry, we can't accept it because we just don't know
Right.
if they
I
passed it.
wholeheartedly agree with you, yeah.
Okay.
I can get back to you on that. And again, we can totally drop the piercing thing and just make it exclusively tattooing.
Yeah, I mean, I don't have a problem with the
Yeah,
piercing.
I want it to be a successful festival, right?
Right.
So
Yeah.
we want them to get what they think they're coming to get, right?
So I'll look into the piercing thing,
Okay.
and back to the board.
So your plan is, once you get these applications, you're gonna call all of these states? I mean, how many people do you think you're talking about that come to these?
Well, I guess it all depends on what venue is going to entertain this festival, whether, it's only going to one or two places in the city. It's going to go to the auditorium, or it's going to go to the arena. So my guess is each vendor is probably going to be 10 by 10. That would be my guess. Because, you need a table, you need somewhere to put your equipment, proper lighting. So I don't know if the auditorium is big enough to do that. I know they could set up on the floor and maybe like around behind where the seats are. So my guess is it's probably going to be at the arena.
The where? Oh,
At the arena.
Right.
So I would have to have a conversation with them to see, like, the breakdown of the floor, like, how many booths can they put in? I mean, maybe 50, probably more. So, I mean, there's gonna be a lot of, if this actually happens in the city, there's a good amount of work that's gonna go into it.
Right. Okay.
So there's permitting money that would go to the city and then money that would go to the arena or the auditorium?
So I'm sure that the Arena Auditorium, they'll have some kind of fee for their event, and then we're gonna have a fee. I put down here on the second page, or I guess the third page,
$100
but that's $100 per day.
per day.
So all of our temporary permit, all of our festival permits are $100 per day. And then, besides that, once this permit is approved, a bigger conversation will be between myself and the director and you guys as to how long do you want us there? So certain events in the state, health inspectors go for like the first 4 hours, and then that's it, and then EMT stand by just in case if there were an issue. It would be up to the city as to how long do you guys want us there? You know, for Folk Fest, we do 1 shift on Friday, 2 split shifts Saturday, 1 shift Sunday. So I don't know if we would want to do something like that. But the event organizer would have to pick up the overtime for my team.
Okay.
So that would have to be
Right.
part of the deal as well.
Okay.
And then.
I'm okay, by the way, with this as it is. I just want clarification on piercings that licensed from states, whatever, that's
Yeah.
it.
No, I'll get you, I can get that. I'll get clarification on the piercing, and like I said, the third page, I pretty much think all the fine print is in there. I can't stress the fact enough that we will not accept anything that's not disposable. Everything has to be disposable.
Yep.
And is the arena responsible to get rid of the medical waste as well? Does the arena take care of that?
I don't have an answer for that, but I'll get you
Okay.
the answer.
So I think we'd have to find that out from
Yeah.
the
Yeah.
Boston and them as well.
I think once this is approved, that I can reach out to the powers that be over at the arena and do have a hypothetical meeting, so to speak, that if this were to happen, you know, who does what?
And then I think on the second page too, I think that if someone comes into the city, I think they have 2 years of employment, I think was usually, right?
Regs for artists in the city is they have to have 2 years of experience.
Right.
I think New Hampshire only requires 1. I know we had somebody come from Las Vegas, they only had 1. So you can go from here
Yeah.
to Drake to Boston, and there's different requirements per town.
Okay. So maybe we should leave it as 1 because some people may come from different states. So I think we'll leave it as 1 then.
I
Okay.
looked at, Worcester held one before, Boston, Sturbridge, they've had one for 25 years, go figure that one, small town of Sturbridge, it's huge out there. But the going year was 1. That's why I put that language in there, because it just seemed uniformity.
Okay.
But yeah, that's, like I said, I think this will work. Obviously, I'll clean it up. We'll get the city logo and everything. And I will reach out to the gentleman that had called me once we get this permit approved, and, see if what he wants to do. Because it's pretty much out of our hands after that. He needs to find a venue for it. But if it happens, it could be kind of exciting.
Yeah.
So it's going to be, it's supposed to bring in a lot of foot traffic. What I've seen in the other cities and towns, it brings in a ton of foot traffic, so.
Great.
And
Yeah. Anything else from the board?
Thank you.
that's about all I got.
Nope, thank you, sir.
Thank you.
Thank you very much,
Stand
everybody.
adjourned. Next item on the agenda is the Lowell Tobacco Control Report. I just had one question. The adult,
Who are you asking you to, who are you
I
asking?
maybe the Madam Director of HHS could check with Caesar, the violation on the adult-only retail tobacco store at Wood Street. It says that they allowed a person under the age of 21 to enter the establishment. My question was, did they sell to that person, or
No, they did not sell to the person, they just allowed them into the store.
This is the whole thing of what the one that was appealed, right? You can't you can't let them in your store.
Right.
So the question is why they let them in the store.
And then the Doman Meat Market, the first one on here, August 19th, Caesar just found out that that store has sold. So it sold in, I believe, the beginning of September, so that one will not hold a hearing.
Can you say that again?
The first one on the list,
Yep.
the violation, the store has sold. There's a new owner.
Oh, okay.
So we can't hold the.
Not the guy's brother.
Yeah. What?
Oh, that's-
You didn't
yeah.
sell it to the guy's, his brother.
Well, who
right?
knows? Who knows who it sold to?
Is the Harry's Food Marks, that's the only one with a different fine? That's a second?
This is a second violation.
Okay.
Yep.
So, but the meat market already paid their fine.
They paid the fine, correct. They came in and paid the fine right after it was issued. And then, I guess, like 2 weeks later, they sold the establishment, so.
Probably hard to sell something when there's a pending violation over the head or whatever, I don't know.
Okay. The next item for discussion is safe needle exchange. So this issue came up before the city council. I'll let the director of HHS sort of give you the background information on why it's on the agenda. If you folks read the letter I sent, not from the board because we didn't have a meeting, but just offering as the chair to assist the council with around the ordinance that they wanted to prohibit needle exchange programs within a certain number of feet of a school and a park.
Does this primarily relate to the high school? Like, are there certain other areas where we exchange needles?
I think it is more like where the stem is, over in that area near
Got it.
Bishop Markham.
Got
So
it.
I'll let Lisa
Okay.
give you the background.
Okay.
So this is related to a gentleman that went to the city council meeting who had a 1, 2, 3 approach. He was going to fix substance abuse, he's going to fix homelessness, and he's going to fix the needles on the street. It is. It actually is amazing. So my whole department is going to be cleared out of the health department. We're not going to have any need for anything. So he basically came up with these suggestions for the city council. So he came up with them. He spoke for 10 minutes when there's a 3-minute rule at the city council. So he spoke for 10 minutes about this. So then that prompted 2 city councilors to come up with a motion for there to be prohibiting needle exchange programs, which that's not what they are. They're syringe service programs. The whole time they spoke about how the church is handing out needles and the van is handing out needles. So the van that is parked at the South Common is actually a van that Lowell Community Health has, that the Kraft family sponsors, that does not hand out needles. So there was a lot of misinformation given during the 10 minutes that this gentleman has been speaking. And since that meeting in August, and probably until this weekend, the information that has been given on social media and the misinformation that has been given, and the amount of stigma that has been given to the homeless people and the people who use drugs and substance abuse has been astronomical and detrimental to the community and to the service providers.
All by this one guy?
Yes, and by other people that are continuing to take pictures of things that they are saying are needles, that are not needles, that are caps of needles and different things. And it is very disturbing to multiple people within my department, including me. And then we write a motion response that says needle exchange programs, which are syringe service programs. So they're only taking one piece of it and not the part that talks about the fact that people are coming in exchanging needles and also getting tested for HIV and hepatitis C, and they're also getting Narcan, and we're saving lives. And that last year, the opioid overdoses, fatal overdoses are down 39% in the state of Massachusetts, and the good work that people are doing.
So somebody in the city council made a motion to prohibit them within 1,100 feet of a city park, 1,000 feet of a school. What was the stated reason behind preventing them from those areas? What was the risk to the kids or whatever that they stated by having them closer?
Well, it just is that they feel like needles are being handed out, and it's actually was 3 counselors. So 2 counselors did one motion and 1 counselor did the second motion. And they just don't want needles given because they said that there are more and more needles being picked up, which was, my mouth dropped because no one had asked me how many needles were being picked up. So the next week, I actually did the graph that you guys have here. So I asked Andres if he could please let me know, because it's the specific area, the STEM Academy and the South Common. So I asked Andres, could you please let me know? So in 2024, there were 3,617 needles picked up at the South Common. And in 2025, from January till, I think it was like the beginning of September, there were 709, which was about a 75% decrease. So the fact that we talked about more and more needles being picked up, it's actually less and less needles being picked up. And then I actually asked him to look at the schools and how many needles have been being picked up at the schools. And in the full year of 2024, 22 needles had been picked up. And year to date in 2025, 28 needles have been picked up. And that would be in all of the schools in the full city of Lowell.
Do you have any idea how many needles have been exchanged in this program?
So there are 2 syringe programs. So I met with Lowell Community Health, and they haven't given me the exact numbers because it has to go through the PR department. And they said that they have taken in more needles than they have given out, but it has to go through before they actually give me the numbers. And they're going to give me some more statistics around how many people have been treated for HIV and hepatitis C and how many people have been tested. The other program actually has a hard time staffing. That's the brick and mortar program. Has a hard time staffing, and they're only open 2 mornings a week. So I'm not really sure if they're even open anymore. On the website, it says they're closed. So I don't really know how many they give out versus how many they pick up. And I just want to say that the Lowell Community Health subcontracts with Riverbend. So they have the craft van, but then they have a second van. So they have one van that does the testing with a doctor, a wound nurse. They do insurance. They have Narcan, but then they have a second van that does some other services and also has the needle exchange. So they have 2 moving parts at the same time.
Question.
Yes.
So I did watch this, but at any point, did anyone mention that we lost funding for our substance outreach prevention?
No.
That got combined, and so we don't have the services that we used to have, and we're still making things work and doing what we can with what we have?
No, nobody had mentioned that. no.
Oh,
But thanks for
No.
putting that on the record, though, huh?
yeah.
Yes, thank you.
And just to be clear, to clarify, the comment about distributing needles, it's 1 for 1. There's no additional needles in the city because of it. There's just cleaner needles in the city because of it.
So sometimes people could get more needles because they're a package of 10 that are wrapped. So someone may bring 9 needles and get 10 because they're wrapped as a package
Right.
of like
It's not-
diabetic. Right.
Here you go, here you go, here you go.
No, you have to bring something. You have to bring something.
I think
Correct.
the important, sorry to interrupt
Right.
you. I think an important point is that Lowell Community Health Center is, saying that they take in more dirty needles than clean needles that they give out.
Correct.
And, if you look at all of the research, it suggests that syringe service programs reduce discarded needles in the community, and they don't, the studies have looked at it, there's been no increased crime because of clean needle exchange. Back in 2018, we had an outbreak of HIV in the city, and it's clear that clean needle exchange cuts back on the transmission of disease. And you know, for some people, that's important. Also, it's the wraparound services that go with a clean needle exchange program. It's, you know, getting, you know, more people that get into treatment and more people that get screened for communicable diseases, and it's all the other, it's the other parts of clean needle exchange that I think, I don't know, seems to have been forgotten in the discussion, or I don't know if it even came up. But, so I sent the letter asking the city council if maybe we could open a conversation between us and them around this proposed ordinance and maybe tweak it in some manner.
Tweak it, I would just vote it down.
So.
Sorry.
Lisa and I had a brief discussion just before the meeting about possibly requesting that the city council substance abuse subcommittee have a subcommittee meeting perhaps on a Wednesday, the next Wednesday of our November meeting, to sort of talk about, you know, what could happen in the range, and maybe the maker of the motion if they're not on the subcommittee, they could come to the meeting and we could have a conversation about this and maybe do some education around what I see as the benefits of a clean needle exchange program. I want to hear from the rest of the board. Do they think clean needle exchange programs, I mean, we only have one. It's not like there's 10 of them in the city anyway.
That's not the issue. The issue is the restricting it at parks specifically, but also the schools, right? So they're not saying get rid of it. They're saying we want to restrict where you can put them.
Well, so if you restricted it to 1,000 feet from parks or schools, there's no place left in the city. There's one little piece of Belvedere and one little piece of Pawtuckaville, according to the MIS people.
Right.
So there technically, if this ordinance passed, there technically wouldn't be any clean needle exchange programs available because there's so many schools and parks,
Right.
which are great, but it over restricts it, I think. But
So what would you like this board to do? I think we all agree with you.
I don't think Lisa
Right.
was finished, but go ahead.
Go ahead, Lisa. Sorry.
No, I'm good. I was just going to say that where it's restricted, it's going to push it to one little piece of Belvedere or one little piece of Pawtuckaville, which some of these people, all of the services are, you know, people go to the downtown area or the Elliott Church or to, you know, different services downtown, Salvation Army or different places. They're not going to go to the other end of Belvedere. And, you know, nobody wanted the high school at Colley Stadium, so I don't think we're going to have these people going to the other side of Belvedere to go to a needle exchange program or to the other side of Pawtuckaville. So I think we need to come up with a happy medium of where this is going to be located.
And, you know, maybe the maker of the motion is amenable to lessen the feet from parks or schools. I mean, I think it's reasonable not to want a needle exchange program in front of a school. But I don't think it has to be, you know, we only have one now, so this is all theoretical. And the one that we have now is probably within 1,000 feet of a park because that's what it serves the most people. So.
Was it Lowell Community Health Center? Where is it?
I'm sorry, what did you
Was
say?
that Lowell Community Health Center? Is that what you said?
It's mobile.
Riverbend? Oh,
It's,
mobile.
well, Riverbend, I think, is close to where either Central Street but it's mobile.
Oh, okay.
So it's mobile, so I think it's close to the Elliott Church.
Yeah.
So I think that's where it is, it's close to the Elliott Church.
What's the isn't there ordinances for like liquor stores and stuff near schools? How close they can be to schools or other things like that? I thought there were some ordinances
The
related to
tattoo one is 1,000
What,
feet.
the tattoo ordinance, I think, is within 500 feet.
500.
Right. And the smoking ordinance is no smoking within 50 feet. And then the school zone is like one, it could be 100 feet or.
It's 100 feet, right.
Yeah.
So,
Their ordinance. This ordinance just mimics what the no tenting within 1,000 feet of, right? And it's the same, it's basically the same thing, 1,000 feet from a school or a park. That's what the homeless, no tenting, like, it's the
Right.
same motion. It's just they're adding more stuff to it.
Right.
So I guess the question is, does the board think we should request a meeting with the Substance Abuse Subcommittee and/or the makers of the motion to talk about a compromise or to do some edification of the program itself? I think it would be good to know, Lisa's getting this information, how many syringes they take in, how many they give out, and the other benefits of the program, and maybe have that information for the November or December meeting to come up with some kind of joint ordinance, or an ordinance that at least allows the Board of Health to weigh in.
So I think that's a great idea. But preemptively, because something else that they had on a motion about was about the safe injection sites. So I feel like
Can we talk about that
we
next?
could talk
Yeah.
about, can we put that all in together and meet with them and try to help them understand different parts of it?
So we were gonna bring that up next.
Oh,
I think
okay.
Lisa was gonna talk about
Sorry.
that next.
Before you go there, so,
Yeah.
my impression was always that a lot of these people that are hang out or live in parks,
They did until they were
so,
asked to move.
so where are they going, where do they go now?
So, yeah, I mean, that's why I think the Riverbend, Lowell House, whatever, the Riverbend mobile van, supported by the Lowell Community Health Center's funds, is probably parks near one of the
Parks,
commons.
right.
But, if the ordinance was, I'm just throwing something out, if the ordinance was reasonable and was 50 or 100 feet,
Right.
people that are sleeping in the parks or sleeping near the parks could still access it.
Right, so I guess my question for you is, yes, we can certainly request a meeting to sit down and negotiate, or we could give what we would consider a more reasonable counterproposal of 100 feet from schools and parks or whatever, that allows people to be access to these important programs without maybe putting the kids at risk, whatever. And if it's good enough for smoking and it's good enough for the school zone in terms of selling everything else, I don't know why this would be any different. Right, like if you sell drugs within 100 feet of the school, the punishment is greater than if you sell it anywhere else. Society's determined that 100 feet from school is reasonable for selling drugs. I don't mean not reasonable, but
Right.
then I don't know why this should be any more onerous. It should be 100 feet from the schools. I would say none for the park, but I'm happy with 100 feet from the park. I just think we might be better served giving them what we think is more reasonable and allow the citizens of Lowell to still get the care that they need and access to the health care that they need. As opposed to saying, let's have a meeting and delay and have whatever. Because we might make the counter proposal and they say, okay, that makes sense, let's do that. If they don't, then we can have the meeting. But I
Yeah,
guess
well,
it depends on whether we're all in
I think we need a
agreement.
little more time, maybe till our next meeting to,
Let me
for
ask
for
you a question.
proposal.
There's a motion, they made a motion. Did they vote on the motion? What do they do? What does that mean?
Well, they voted to send it to the law department, right?
Right.
So the law department, they're waiting for the law department to come up with an ordinance. So it isn't gonna be anything that's gonna happen.
Right, so we do have time
Before
for
our
that.
next
Got it.
meeting.
Okay, all right. I have visions of them saying, yep, next meeting, we're done, good,
No,
thanks.
no. My understanding is that, right, Lisa, it's in the law department for creation of an ordinance.
Right,
we-
and then the law, and then the chair of the Board of Health wrote a letter stating that the Board of Health would like to weigh in. So I believe that from this meeting, we should send them some kind of communication about something. So maybe the board should send a letter stating that the board disagrees with what you should send a letter stating that you disagree with what they have come up with,
With a proposal, with the,
and state that, you disagree with what they come up with, what they've come up with, and you'd like to either meet with them or, these are the reasons, and you'd like to either meet with them to talk about it, or you would like to have a counter proposal.
Well, let's, yeah,
What do
I
you,
would just suggest that we invite them to, ask them if they would consider a Wednesday subcommittee of the Substance Abuse Subcommittee on that Wednesday that we meet in November to sort of, to talk about the ordinance.
so I guess my question for you is this. There's a motion on the city council been made and sent to the legal department. I don't want to honestly waste my time talking to a sub-council of people involved who are probably invested in substance abuse programs and really probably maybe are agreeing with us. If they don't then have the authority of the city council, they have to go back and then get the city council to agree to the compromise. I'd rather meet with the city council and like, let's get this done and not have to have,
Well, it was unanimous.
so my point would be,
Right, the ordinance, was there a no vote?
3 were absent.
3 were absent.
so my point to you is, I'm not sure what we're hoping to accomplish by having a meeting with the subcommittee of the city council that deals with substance abuse. What do we think we're gonna accomplish
Okay, well,
with
we
that,
could invite,
right?
we could ask the makers of the motion to come to the next meeting to discuss it.
At the end of the day, I don't want to waste our time if it's to no avail. I would suggest we meet with the people who are making the decision, so that if we can convince them that this is
So that would be the
onerous,
makers of the motion.
then I'd rather invite them than the subcommittee.
There's actually 2
associates.
parts to the motion, so it would
Right.
involve 3 city councilors.
My personal opinion is we should send them back a proposed revision of their motion to decrease the number of feet from the parks and the schools. But I'm happy to do at least that if you prefer. But I'd rather meet with the people making the decision than a subcommittee that may have no authority on behalf of the city council, nor any interest.
Right, so if you prefer, we could ask the makers of the motion to consider,
If they say no, then what?
Well,
well,
We're asking them to come meet with us.
right,
They could say no.
yeah, they could, but I'm not anticipating that. If they say no, then at the November meeting, we'll talk about what we think should happen after reviewing everything, and send another letter to the full city council saying that this is what the board's suggestion
Okay,
is.
all right. Yeah, I'm still feeling like we've got to be doing tomorrow, so I apologize.
I'm sorry?
I'm still feeling it has to be done tomorrow, so I
No,
apologize.
no, it's,
fine.
shall we say, at the law department.
Yeah, tell them to stay there. Tell them to keep it there.
So you-
Is that,
So what is the motion then?
Right now, I just had to ask the makers of the motion to consider coming to the Board of Health meeting in November to discuss the issue.
How will what's the wording? Ask them to consider?
Invite them.
invite,
How about, yeah, I don't like to ask to consider. I would say we invite them to come to the next meeting so that we can
invite the
talk
3
about it.
makers of the motion to come to the next Board of Health meeting to give us their views on the matter and to discuss the ordinance. And maybe, you thinking we should invite the city solicitor or no? Or someone
Yeah.
from the city solicitor's
Mhm.
office?
He was going to come tonight, but he had another commitment.
With with an invite to the city solicitor.
I mean, we can extend the invitation to the rest of the city council as well. So we can invite the rest of the city council as well.
So you'd like to invite the city council?
But especially the makers of the motion.
3 makers of the motion to come to the Board of Health meeting in November to discuss their views on the matter and discuss the proposed ordinance.
In that discussion, was it clear to the city councilors at the time the impact of the distance and that it was going to be confine these things to those 2 small areas? Was that something
No.
that came after the fact?
Came after the fact.
Okay, thank you.
So I just need somebody to make the motion.
I'll make that, sure, as long as I don't have to say it again.
try stopping you. I'll second that.
All in favor?
I,
So then there was a second piece after that, a few weeks later at the next city council meeting, which I wasn't going to bring up, but Aaron wants to bring it up, the overdose prevention centers, which they called them safe injection sites. So there is a House bill right now that has not been passed, has not been voted on, to have safe injection sites. So this is like year 8 of this. Has not been passed. Probably will not be passed. So the city council, one of the city councilors brought it up for a motion for an ordinance to ban them in the city. So there was 4 speakers. I think 3 wanted to have Lowell to be able to have them, and 1 was opposed to it. 1 counselor spoke against them. I forget what Eric even spoke about. And then he quickly took a vote. A couple of other counselors wanted to speak, but they took a vote to send it to law for an ordinance,
To prevent them.
to ban them in the state, to ban them in the city of Lowell.
Was that a unanimous vote as well?
The mayor was absent, so it was, no, Counselor Noon voted no, because I think he was mad that he didn't get to speak at it.
Good for him.
So it was a 9-1 vote. I don't feel that we need to have very much conversation about that here, because it is October 1st. I'm not quite sure. It has not passed in the last 8 years. I'm not quite sure it will pass in the House at all. Right now, New York has 2 of them. They are not funded by the state. Rhode Island has 1 that has been up and running since January, so it's been up for 9 months. They voted it in, and it took them 3 years to get it funded and to get all the logistics running for it.
Yeah, so is there any data on the results of doing that in terms of safety, overdosing?
I haven't really seen much on the Rhode Island one. Everything that everybody is presenting are things from, like Switzerland has 8 of them. Canada has a couple of them. But they still have overdose deaths and things in Canada. So I don't feel like that one is anything. So, yeah.
I feel like the part of the conversation that was missing is what other services those sites offer and what services that the city of Lowell already offers, minus the supervision of injection sites. So I just felt like that part of the conversation was missing.
And they also talked about it very derogatory. They spoke about it by the wrong name, and it was just very unfortunate.
Okay, so that could be a down the road issue that comes up here for discussion, but it's not anything. Yeah, I don't think we're ready to
do now.
We need to go there tonight. I don't think the legislation is going to pass, but that's just my personal opinion. I have some issues around safe injection sites, but I think that it's all hypothetical right now in terms of what the state's going to do.
Can I just say that we've discussed 2 issues that I'm unclear why the city council would take any action without actually asking the Board of Health for an opinion. Like, are we?
That was the purpose of the letter from the Board of Health
Like,
chairperson.
seriously. On the record, that's what we're here for, I thought. So, put that in the minutes.
Dr. Galvin said, stay in your own lane.
Well, I also have to say that, we collect data at the health department all the time, and that is something that we do month after month, posted agendas on time, and I wasn't asked for anything. And I sat there in a meeting that things were said, and I was like, wow, that's amazing. I didn't know that. That happens? That's absolutely incorrect. And I listened to a man get up there and talk about things, and I was like, I actually had two phones going, and my phone was blowing up that I was listening to him, that I actually just shut it off and put the other phone on and listened to him, because my phone was blowing up, and they're like, what is this? There's needles at the church, what is this? And I'm like, no. I had to fight, like, and text and be texting people, and I had to, like, text people to be like, damage control here, because, like, this is not gonna be good. And I'm still doing it 6 weeks later.
Yeah. So that's what the letter was for, as an offer to provide some factual information and from some medical health professionals and the Board of Health. Okay, anything else?
Thank you for sending that.
Thank you. The next item on the agenda is the body art apprentice license for microblading.
Is this one of the two ladies that we've come to know and love that comes, or that's the new
One's gonna
person?
be with one of them.
It's gonna be, person's gonna be with them, with one of them, right?
Do we have a motion to approve Anna Caterina Amaral Ribeiro's apprentice license to work at Heaven's Beauty on Middlesex Street?
Motion to approve.
Second,
Second.
approved. We need a roll call, no. The next is a body art practitioner license for Anthony Stanley for Lowell Inc. for tattoo only. Do we have a motion to approve?
Motion to approve.
Second.
All in favor, aye.
Aye.
Next item on the agenda is the Pride Star EMS reports. As mailed, any questions, or as emailed?
Nope.
Next item on the agenda is the monthly report from Cashins on the Lowell High School air quality.
Looks like some dust, right?
I'm sorry?
There was some high levels of dust in a few.
Yeah, there was one section.
So is this the one with the basement,
Yeah,
the
basement.
two areas? So there was a footnote saying that
The door was.
door was open, I believe, right? When something was on the other side.
Yeah, and they also needed to close the door where the carbon monoxide was coming from the machinery. Stairwell C door.
We're assuming that that is now being done, right? So hopefully that won't happen.
We are assuming that,
What happens when you go to school within a school?
right? That's my agenda. The next item is the EFI Global Pawtucket Memorial Elementary School. And everything looked good except for
One classroom.
two, I'm sorry?
One classroom.
Two classrooms, 1077, 1083. Same two classrooms that had some issues before. Lisa has spoken to the commissioner about taking a look at those classrooms and seeing if there's anything that might be contributing to the potential concentration of fungal spores. I don't know if you want to say anything else, Lisa.
Yes, and I spoke to him right as I was coming here, and he spoke to the school side, and I did mention to him, because when we were there, like, we had seen, like, books inside of, like, containers and things like that, and one of the things going back to the state report was that two of these rooms were the ones that had area rugs in them, so I did ask if they could go back to see if there were area rugs in these two rooms. And also on the June report, the there were windows open as well, so I did ask if, when they do the reports, if they can see if there are windows open as well, because that does make a difference. Because when you see the footnotes, it does say that it's the same mold that's outside, so it does make a difference if the windows are open, so that would make a difference when we look at it. And he did say that the roof for this school is going out to bid, so that's where that is.
That would be good. This roof has been pending for a while. That's nice. The chiller is working. Any questions from the board on the Pawtucket Memorial? The next item is the division reports and the health director.
So on the public health report, the only change on the West Nile is that we are up to 8 human cases of West Nile. There was one addition last week, and that is in the state, not here. And then the flu clinics will be starting at the health department coming up soon, because it will be October 14th, October 21st, and October 28th. So those will be the Tuesday clinics from 4 to 7 at 107 Merrimack Street. And then we will be starting our home vaccine program. So if anybody would like a vaccine for a homebound person, they can call the public health nurses at 978-674-4308, and one of the nurses will do the homebound flu vaccines. We only have COVID vaccines for uninsured. We will not be purchasing COVID vaccines.
On the home visits,
Yes.
is that something that you advertise to like Lowell community and PCP offices, et cetera, or is that, how would we spread the word on that? Or do you not necessarily want it spread?
It's on our webpage, so we don't really spread it very much.
Do you
We-
want it spread, I guess is.
Maybe we are putting out an offer to a second public health nurse, so maybe once we do that, then we can start to spread it.
Let me know, because there are definitely
Yeah.
patients identified as not
Okay.
able to get to the office. It'd be
Okay.
great if they had a resource to help do.
Okay.
So,
I mean, if you hear of anybody, just, you can
I'll let the,
give our
I'll let
number.
the team
and-
know to call.
yeah.
Yeah.
I don't know if does the mobile integrated health do vaccines at all for,
Good question. I don't think that they do. It doesn't mean
Okay.
it necessarily couldn't, but I don't think,
Okay.
not right now. That's not what.
okay.
Just one thing on the immunization chart, on the immunizations given,
Yes,
looking at the MMR.
yes.
If you go across, 1 was given in June, 1 in July, and 3 in August. But is this final column total for 2025? Shouldn't that be 5?
Yeah, the column must not have updated when she did it.
Okay.
I'll make sure it gets added on.
And then also in there is the Substance Abuse and Prevention Division.
Yes. Are there any questions?
No, still exists.
And also with that, Dr. Galvin, so we have added a couple of members to the co-op team. So if there are any offices that are looking for Narcan training, the team does go out and do Narcan training. We do have a Spanish outreach worker, and we do, so we'll do it in English and Spanish. So if anybody's looking for Narcan training, they will go out and do Narcan training as well.
Okay. Thank you.
You're welcome.
Any questions, comments? Do we have a motion to adjourn?
Yes, you do after the question's asked, though.
Oh,
Sorry.
No, go ahead.
Just on the syringe pickups that Andre got, that's just the schools, and then this, with the picked up well in the community is just a general, anywhere?
Which, is a syringe proactively picked up in the community, the last one?
Yep,
1077?
yep.
Yes, that's everyone picked up proactively in the community, so that's just him and Tom out and about. So sometimes when they're out and about, they will find, just like a red container, people will just dump like a red container somewhere or a couple of red containers somewhere. So sometimes I think people don't know where to go, and they just, at the side of the road, they'll be like, a red container dumped somewhere. And they weigh it, and then that's how they get what it is. And sometimes there's like 2 or 3 of them just dumped somewhere. Yeah, kind of weird.
Like, we don't have days that you can come and drop them off.
You'd be amazed. And when we do the days, sometimes people come with like a whole trunk of them, like they've been hoarding them or something. People really don't know where to go.
You can also bring them to, like, CVS has a big bin, you can
Right.
put them in.
But people don't know.
Those don't know.
Yeah.
Or they may not want anybody in CVS seeing them.
Motion to adjourn?
Oh, wait. Did you say that?
I did.
Second.
Second, all those in favor, aye, motion.
See, you did that question thing on purpose.